What's the difference between Medicare and Medicaid, and will Medicare pay for nursing care?
Well, first, generally, no, Medicare is not going to pay for nursing care, but let's back up a little bbit and explain why, because a lot of people get these programs confused. Medicare is the program that you qualify for at age 65, and think of Medicare as your health care insurance. It usually helps with things like a trip to the hospital or doctor's office. Think of it as short-term care. And then Medicaid is a need-based program. So think Medicaid is like financial aid. That's a program. There's a lot of different Medicaid programs, but for our purposes, usually the one that we're concerned about is Medicaid for long-term care expenses for seniors. And that's where Medicaid will help pay for nursing home care. And, a lot of people get those two terms switched around because they do sound so similar. So often you might hear somebody say, oh, when grandma was in the nursing home, Medicare paid the bill, or when, my parent was in the nursing home, they got some help from Medicare. And most of the time, it was actually Medicaid that was helping them, and they might just be confusing the two programs. What can create some additional confusion is Medicare, which is, again, the one like health insurance. Medicare will pay for rehabilitation. So what might happen is if somebody's admitted to the hospital for at least 3 days, overnight stay, and then they're discharged from the hospital directly to the nursing home for rehabilitation, Medicare might pay for that rehabilitation for a period of time, and the rehabilitation may take place at a nursing home. The amount of coverage there can be anywhere up to 100 days. Medicare will pay the first 20 days, and then days 21 through 100, there's a copay. But it's really however long care is needed. So 100 days is not guaranteed. If the person maybe only needs 30 days, then that's what they'll receive. But that's more of a short-term situation. If we're talking about long-term care, then Medicaid is typically the program that we're going to be talking about. And it can be really important to understand that distinction because our current health system can create some really different outcomes depending on what program we're talking about. So a way I like to explain it to people is say, imagine you might have two neighbors. They live across from one another. They've had very similar careers. They try to do all the right things. So they saved up for retirement. Now they're retired. Neighbor number one has a massive heart attack, goes to the hospital, receives treatment. He's in the hospital for a few days. They patch him up. He returns home. That's going to be your classic Medicare type of situation. You might be responsible for some co-payments out of pocket, but often your Medicare supplemental insurance, if you have a policy, that will help with that. And so for something like that heart attack example, the out-of-pocket expenses might not be all that cumbersome. So a lot of people might not even realize that the actual costs of something like a massive heart attack can be anywhere between $750,000 up to $1 million, right? But we don't see that because Medicare is going to pay a lot of that expense. Compare that with neighbor number two that did all those same right things, saved up for retirement, but instead of having that massive heart attack, instead neighbor number two winds up with Alzheimer's. Medicare is not going to be there to help with something like that because Medicare doesn't help with long-term care issues. That's when we usually might turn to something like Medicaid if the person needs assistance.